Alright folks, so after today's class, I went online to look for a suitable article for you on falls from a height and the injury patterns that are associated, and I realized there aren't really any good summaries. So I decided to try to make a video to help you through this. It's not a very difficult topic, but just understanding the basics will help you remember the kinds of injuries you should be looking for. Okay, so let's think about a 43-year-old construction worker who is brought into the emergency department after falling 8 meters off a ladder onto his feet. So remember, anything more than 6 meters is considered a fall from a height. So I want you to think about the injuries that might occur from this mechanism. The purpose of this lecture is to give you the skills to list the injuries associated with falls from a height, both skeletal and soft tissue injuries, to think about the biomechanics and be able to describe the biomechanics of these injuries, and then finally we'll look a little bit about how we approach the management of these patients in the resuscitation room. Alright, so let's think about the mechanism of action from a fall from a height, and for these purposes we're really thinking about what we call falls with axial compression. So you either fall onto your head and the force is transmitted from your head up your spine through your legs, or alternatively you fall on your feet and the force is transmitted through your feet up through your lower limbs, through your pelvis, up through your spine. So when we're thinking about the skeletal injuries that can occur, these are really due to compressive forces along that axial skeleton. So anywhere from your heel go right up to your head. And we'll talk about these in a lot more detail in the next slide. We can also sustain extra-skeletal injuries, but specifically related to the fall mechanism. And these are usually acceleration deceleration injuries, and if we remember that mechanism, then it's not hard to figure out that most of these injuries occur where fixed and mobile structures meet, and then when the fixed structure is abruptly stopped, so when the person falls and hits the ground, the mobile structure continues to move and there is a shearing force between the two, which could cause tearing and injury. Similarly, if you have a fixed structure inside a rigid container, so for example the brain inside the skull or the lungs inside the chest wall, then when the fixed structure, the fixed container stops, so the chest wall stops or the skull stops, the mobile structure inside the brain or the lung continues to move and may be compressed against the cage, so the lung compressed against the rib cage or the brain compressed against the skull. Bear in mind as well that there may be non-specific injuries just related to this amount of force applied to the body, and most patients don't fall directly onto their feet or head, but they may fall and roll or fall awkwardly, and then they are exposed to high energy blunt force, leading to various compressive injuries, contusions, burst lacerations, fractures with impaction, or rotational, tractional and shearing injuries. The arm may be twisted awkwardly and break or dislocate and so on. So remember, although we're going to talk about typical injuries, there are many common injuries that will be seen in falls patients, as with any patient with high compressive forces or high energy blunt trauma. Let's think a little bit more about the skeletal injuries. So as we said, we're thinking about the patient falling primarily either on the feet with the force being transferred up to the head, or on the head with the force being transferred down through the feet. So if we go from top to bottom, the spine can be injured. The compression of the atlas vertebrae between the base of the skull and the body of the axis can cause a splitting of the ring of the atlas, which is really the Jefferson fracture. Compression of any vertebral body between the bodies above and the bodies below can lead to burst fractures. Chance fractures are a specific type of burst fracture often seen in patients with growing skeletons, so in adolescent children, for example. And then of course any vertebral body may suffer a compression fracture of the body of the vertebra as part of this injury. If we're going to fall on our feet, it's likely one foot will hit the ground before the other, and then the force goes up that foot. When it reaches the hemipelvis, that hemipelvis is pushed upward and may separate from the one on the other side, the contralateral one, leading to a vertical shear fracture. The force through the femur and through the head of the femur may actually punch through the acetabulum, leading to a central hip dislocation and acetabular fracture. In the lower extremities, we may get tibial plateau fractures as the distal end of the femur is compressed against the upper end of the tibia, or we may get disruption of the femoral condyles for the same reason. Ankle mortises undergo anvil type injury. The talus, the articular surface of the talus, punches up through the mortise of the ankle and splits it apart. And of course, calcaneal fractures are quite common with falls from a height as well. So what about the extraskeletal injuries? The brain floats in the CSF inside the skull, so it is relatively mobile. And as a person falls, when they hit the ground and the skull stops moving, the brain continues to move, leading to shearing forces between the brain and the skull, bleeding of the bridging veins, which may lead to the development of subdural hematomas. Also, the brain is compressed against the inside of the skull, leading to cerebral contusions. When we're thinking about fixed and mobile structures in the chest, this may lead to bronchial rupture, diaphragmatic rupture, and aortic dissection, and the fixed point in the aorta would be the ligamentum arteriosum. So we often get tears around the ligamentum arteriosum. Again, as the rib cage stops when the person hits the ground and the lung continues to move, this can lead to pulmonary contusions. The bowel mesentery is the way that the bowel is fixed to the posterior abdominal wall, and therefore there may be tears of any part of the mesentery, because again, as the body stops, the bowel continues to move and the mesentery is put under shearing force, or is pulled tight, and that can lead to tearing. Similarly, solid organs such as the liver, kidney and spleen may continue to move as the body hits the ground, and this shearing force is felt most at the pedicles of these organs, which may lead to disruption of the pedicle and severe injuries, vascular injuries with bleeding. Finally, some of the soft tissues around the pelvis, such as the urethra, may be damaged in association with pelvic fractures. So let's think about our approach to management. This is not going to be in any detail, but just some things to remember. So firstly, always have a high index of suspicion. We don't think about falls from a height in the same way that we think about road traffic accidents or penetrating injuries, but in fact, in many situations, they produce more severe injuries, and therefore we must have a high index of suspicion for injury in any patients presenting with a fall from a height. If we understand the mechanism, as we discussed, we'll know where to look for the injuries. Remember that patients often have more than one injury, so we should be searching for related injuries, and when we find a single injury, we should not stop our search. Especially the intra-abdominal injuries and intrathoracic injuries may be initially hidden. Therefore, we should have a low threshold of investigation for these patients, including various forms of imaging, X-rays, CT scans, or ultrasounds. Always consider the spine. The spine is often injured, may be hidden by other distracting injuries, or may not be obvious initially. So always immobilize and consider spinal injuries. And it is worth monitoring these patients over a period of time. Most of them, even if they don't seem to have injuries, will need admission for monitoring because the injuries may show up later. If you have any questions, you can ask them in class. So in summary, we looked at injuries caused by falls from a height, including skeletal, non-skeletal, and other injuries. Thank you.